Hi, I'm John Shanahan, President and CEO of Ionogen and of Ionogen Pure Products. I'm sitting here today with Dr. Brigitte Overholt. Hi, Dr. Overholt.
Hi, John.
We're here to talk about a possible alternative to slowing this spread of the virus that doesn't seem to be getting the attention it deserves. Dr. Overholt, you've done a great deal of research on the power of hypochlorous acid. Tell us a little bit about your research and your curiosity.
The story begins about 3 years ago. In my specialty of gastroenterology, we were seeing infections transmitted by a certain kind of endoscope. And so I looked into scope design, I looked into different types of disinfectants, and what I came across was hypochlorous. It was reported in a deep study of the literature. I could find nothing but positive results from it. So I still didn't believe it. I tested it in an ambulatory surgery center. I tested it in two public schools. I tested it in the blueberry industry, and I did those things personally. So I'm comfortable with the results, which all showed significant improvement in cleaning and sanitation and disinfection of all facilities, the ambulatory surgery center, the schools, and the blueberries.
So it's interesting, the history of this solution isn't new. It dates all the way back to the late 1800s, but it's never been highly effective, and it's never been scaled in a way that could kill aggressive pathogens like we're seeing today with COVID-19. So most things that kill germs are poisonous to us. We hear regularly about the use of alcohol, but for those of us, people like myself who have atopic dermatitis, I can't use alcohol. My skin wouldn't tolerate it. I'd wind up being left bloody. But hypochlorous acid is so safe, and it can be scaled to be effective in use as a hand and skin product. So when we take this sprayer, we can put this at the strength that CDC recommends, which is 500 parts per million. Put it on our skin and hands, and it's absolutely so safe that even if I were to spray it in my face or my mouth on a child, it would never harm us. We make it in formats that make it so easy to distribute that at more than 650 parts per million, well above that CDC range, this product can be used very effectively to disinfect surfaces. In fact, it doesn't need to be wiped off. We simply spray it on a surface and allow it to sit. So when we give people a hand and skin product that's not harmful to them, and then we give them a sanitizer or medical grade disinfectant, what we wind up with is a highly effective way to kill the germs quickly that isn't harmful to the surfaces, to us. Now this is effective in the home, and it's effective all the way out to healthcare. But Dr. Overholt, there's another value that hypochlorous plays as, I think, what doctors call a prophylactic or sort of a preventative. Is that right?
Yes, prevention.
Okay, so tell us a little bit more about what's another way that in a building that has to stay open, say a convenience store because we need to shop, or a grocery store, or even a medical office. What's another way that people could actually do preventative work without perhaps even spraying the product? Would it be that they could put it into a preventative device much like this mister behind us?
The two ways that we would approach that would be, one, the person actively spraying and misting as you had just shown. The second way would be to use a machine like we see here. That's a cool mist machine, and you turn it on with the hypochlorous solution in it, and it mists, as you can see. This will cover the room and a wide area, and it will create disinfection and cleaning of the facility.
So let's think about that. We have this great need for things like ventilators, and we're short for ventilators. This is an alternative homeopathic way. There are respected ENT physicians, internists, and even some of the most respected allergists in our nation who will back the fact that this technology provides a reduction in the swelling of the mucous membrane. It's breathed into the lungs. Think of the safety of this, much like you would think about what is today known as a saltwater swimming pool. You wouldn't fear swimming in a saltwater swimming pool. What we're doing here is putting a passive amount of hypochlorous acid into the air. We can breathe this. It's used in surgical procedures. It's used in wound irrigation. It's used in eye surgery. We can breathe this in. When the whole room is full of this, it's like being in a room of a swimming pool. This passive approach, when used with someone who potentially is even suffering with COVID, could in fact alleviate the use of ventilators because it would shrink the swelling, pass into the lungs. Now let me ask you a question, Dr. Overholt. Do you have any concern as an internist that breathing in this vapor could be harmful? And do you have any experience with any patients or friends in our community who have used this?
I have studied this subject about toxicity extensively, and I do not find anything that supports toxicity of hypochlorous. Yes, I do have friends who have used it, both in pulmonary and in allergy, and you're correct. When this is inhaled, it has an anti-inflammatory component to it, and then furthermore, when it gets down into lung tissue, where the replication of the virus is occurring, it would at least logically reduce or eliminate the replication of that virus. People are going to get better if they use hypochlorous.
So we've seen this prior to COVID with the flu. Our company has been producing this solution, and we have numerous studies of people who have used this when they get the flu. As a matter of fact, our director of the local Boys and Girls Club contacted me when his daughter had influenza, a very severe case on a Friday night. She began this regimen in her bedroom, passively. By Saturday at 2 in the afternoon, he would report to us all that all of her symptoms were gone. Now, she was tired, but her fever had broken, her breathing had been eased. So this is a great value that being overlooked. So what we're asking you, as our friends in the media, we're transmitting this to the government, but of course the government's quite busy. We're asking you as physician and inventor, this is technology that can be scaled. It's here in East Tennessee, but it can be scaled to support thousands and thousands of people. We'd like you to know that there are alternatives, from skin and hand treatments that are highly effective, that leave the skin very soft, to disinfectants that don't hurt us. We're asking you to help us get the message out. You can contact us today at ionopure.com or my direct phone number of 815-307-9016 or my email of john.shanahan@ionogen.us. Please help us get this preventative into the marketplace today.